We touched on research at the top of the program, but are there other areas of research that you're excited about and that patients should know about?
Yeah, so one of the things that I think is being really talked about in cancer care and medical care in general is if disparities exist between minority patients and white patients. And I think this is a really, really important topic. So the American Society of Clinical Oncology, which had the conference recently, really made this a mainstay point of the conference this year. And there were a lot of abstracts that were defining whether disparities exist. And hopefully by defining whether disparities exist, we're able to target those disparities to make outcomes equal for all our patients. So in the CLL world, one of the things that I alluded to is that a lot of our therapies can be really expensive, right? And so if these new therapies are really expensive, it really may widen the disparity gap for patients who are minorities, as well as patients who come from lower socioeconomic status.
Absolutely.
And so there were two abstracts. One was an oral presentation that looked at the National Cancer Database at ASCO that showed that Black patients do have worse overall survival than white patients. And then I actually did my own study looking at the SEER database, which also showed the same exact thing, even when controlling for socioeconomic status. So I think addressing these disparities, making sure that there's equity amongst our patients, that everyone has equal access to these drugs and can afford them, especially when they make our patients live longer and are safer than chemoimmunotherapy in CLL, is very, very important.
Dr. Kittai, if a patient feels like they're not getting equitable care, are there resources available for them?
Yeah, so one of the things that I love about the CLL Society is that they have a section called Access an Expert, I believe. So look on the website. I'm not sure if it's actually called Access an Expert, but it's a way for all patients to get a second opinion from one of the CLL experts listed on the website. And so if somebody is feeling like they are not getting access to the most beneficial treatment for whatever reason, seeking a second opinion and using the CLL Society's website to find that second opinion, I think would be a great way for someone who feels that way to get access to the care that they deserve. I believe there are other ways to do this through the Lymphoma Research Foundation as well as LLS, but I know for sure on the CLL Society, there is a link that you can click that you can get access to a second opinion.